With many care locations around Florida, Lee Health has made the acquaintance of not one, but three major hurricanes over the past 2 years. First came Hurricane Ian in the fall of 2022, and much more recently, Helene and Milton swept across the Sunshine State, impacting hundreds of healthcare facilities and complicating patient care. These two frequent natural disasters have taught caregivers some hard-earned lessons about preparing for the storm and recovering from the aftermath. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. In this podcast, hosted by Ben Wise, Senior Program Manager of Communication Strategy with AHA-funded partnerships, we hear from Dr. Scott Nygaard, Lee Health's Chief Operating Officer, about what his organization has learned from dealing with disasters. For example, the importance of taking care of employees as well as patients. This podcast was made possible through the Convening Leaders for Emergency and Response, or CLEAR initiative, a funded partnership between AHA's Health Research and Educational Trust and the Administration for Strategic Preparedness and Response.
Dr. Nygaard, thank you so much for being here today. When we scheduled this conversation with you a couple months ago about the relief efforts from Hurricane Ian, we of course had no idea that two more hurricanes were heading your way to the Florida coast. Just wanted to start and check in to see, how are you, the staff at Lee, and the community there? How's everyone doing?
Yeah, I think since Hurricane Ian, that was a very traumatic event dating back to September 28th of 22. And people who had lived here for years had never experienced the type of surge and issues we faced in Ian. And now all of a sudden we've had two additional hurricanes, which have caused some significant impact to the Florida marketplace as well, Helene and Milton. So a bit of a trauma and anxiety each time one of these storms starts coming in at this point.
And before we get into those recent hurricanes, let's start then with back in September of 2022. Take me back to that moment. When did you first realize the gravity of the hurricane and the immediate after effect of what you and your staff did there?
Yeah, well, coming from the Midwest, I was more used to tornadoes, which are a very sudden event. A hurricane, you have a lot of warning ahead of time, and everybody's tracking the storm and following it. The interesting thing with Ian is kind of at the 11th hour, it took a right-hand turn out of the Gulf and headed immediately for our area. And previous to that, we thought it was going to hit more the northern coast of Florida, more in the Tampa region, as Helene just did. I would say part of the challenge we faced was a delayed evacuation process, for example. And people who had never experienced surge were probably a bit complacent and chose to even stay in their homes, never having experienced a surge of that magnitude before.
And there are so many needs in those times of crisis. What did you and Lee Health do to support the staff, the patients, and even the broader community there?
Immediately after the event, there was so much devastation. One of the biggest problems we faced was simply just communication and trying to track down all of our staff. Cell towers were completely wiped out. There were major outages in electricity. And so the biggest first event was really to track down our staff. Following an assessment of the devastation, we realized a lot of people who had parked on our property had lost their vehicles from the amount of surge and flooding. And long term, we supported them by paying their auto deductibles to make sure that they were covered in that event. We did provide rideshare free of charge, about $220,000 in benefit to our employees to get to work. To their credit, despite all the devastation and personal loss, they were still committed to patient care. We provided child care free of charge, about $370,000 worth of child care. We provided direct grants to our employees to try to rebuild or clean up in the aftermath of the hurricane. We directed them to our partner in the United Way. We've got an employee assistance fund, and we paid all staff wages for 2 weeks, whether they were working or not, just to make sure that people had a continued income stream to support their family.
That's incredible. And I can only imagine all the hardships that come along with those sort of things. I heard you in a panel discussion earlier this year quote the philosopher Mike Tyson that everyone has a plan until they get punched in the mouth. I'm sure you had elaborate emergency preparedness, hurricane preparedness plans, but what sort of things maybe surprised you about Hurricane Ian or were outside the box?
So, like I said, I think, yes, we had a plan, and yes, we had an incident command center, and we thought we were ready. And the reason I made that comment was just, it is true, right? You think you have a plan until things start falling apart. So, for example, we had never experienced the devastation of communication. Another thing we had to do post the storm was set up Starlink communication centers since all the cell towers were wiped out so that we could get back to having access, including phone and Wi Fi access. We also provided that to the public in a number of locations so they could contact and outreach to their families and friends and people who are concerned about their well-being. I would say evacuation starts much earlier now. If you look at the Florida map, trying to get out of Florida, there's only really two major roads. On our side, it's I-75 North. And imagine trying to evacuate millions of people up that corridor. It turns into a parking lot. And then you have issues of gas availability as stations start to run out of gas because people are anxious and filling their cars, preparing for their generators. So a lot of issues emerged that we had not foreseen. The loss of water was a major issue. Never seen anything like that. Our public utilities, because of all the turned over trees, lost our entire water supply. And we had prepared for potable water, but we had not prepared for water pressure for fire suppression. And so our facilities were deemed unsafe. And at one point, our local healthcare agency, ACA, decided that we should begin evacuating some of our hospitals. We did fully evacuate our children's hospital, relocated all those patients. And the adult side, we felt like we could not evacuate and provide needed emergency services. So they allowed us to stay open while we, worked to restore water pressure.
I wonder if you could talk a little bit more about some of the issues that you had with water and the changes you've made since 2022. I know you've built some walls and things similar to that.
So, one of the things we realize is to have access to water for fire suppression. A method to solve for that would not to be dependent upon the local utilities, but to build deep wells on each one of our hospital campuses and power those wells with our emergency generators so that we could have adequate water pressure for fire suppression. Our facilities overall were pretty hardened. Despite the size and over 100 locations, relatively speaking, we had little damage to the facilities themselves, about $10 million, which, is real money, but not significant in the grand scheme of things for all the locations we had. We had some clinics out on the barrier islands that were impacted, obviously, and destroyed. But I would say one of the biggest things was that, and then the preparation for like a Starlink service post if we had that type of devastation from a communication perspective so that we could contact and make sure our staff were safe. So those were probably the biggest things.
It strikes me that as COO, you have to consider all of those infrastructure needs, but there's also a lot of human needs with that. How does something like childcare play into disaster relief planning?
So as you know, I mean, the first thing we all worry about is our families and loved ones. And when you're at work and you're called in and we have a team A and a team B response, the number one thing people want to know is my family safe so I can focus on my work at hand? So making sure that they have adequate care for children is a big need in a time like this, both pre and post storm, while they're continuing to try to work through the effort. So childcare sounds simple, but it's a big deal to our staff, many who are working parents, and was critical to the support. Transportation, I spoke about, the importance of that in terms of being able to get to work. And a lot of people had problems with their own cars. So if we had the availability to go pick them up, they were willing to, come to work.
Such a great example of resiliency demonstrated there. And along those lines, even with some of these hardships that these disasters and hurricanes bring, communities often come together during disasters. I wonder if there's any success stories that stand out to you about Lee Health's role in these events and coming together for the community.
One of the most amazing things, I think, immediately during the storm, we had a physician of ours who lived out on one of the barrier islands, Pine Island, and weathered the storm out there. But immediately following the storm, took an interest in the community there and set up, basically a triage center on the island at the local fire department and provided care to people despite her own personal devastation. And so it was pretty amazing that we had people reach out like that. We had a lot of stories where people just were out helping neighbors and friends, the community, muck out houses. There's a lot of debris and stuff that kind of comes through after that cleanup. I would say, even despite the fact that we're 2 years later, now we've had a couple other storms. So I've had people in our community who've been now had water intrusion in their home from 3 different storms.
And let's pick it up there. How is the community doing after Hurricanes Helene and Milton? And What lessons learned from 2022 have helped recovery efforts both for Lee Health and the greater healthcare community in West Central Florida?
You do the best you can, right? And despite all your efforts, you still know there's hardship. We've had businesses that have closed permanently, not able to reopen after multiple insults like that. Our United Way is a tremendous agency, coordinates a lot of resources. We did refer a lot of people to that in terms of 211. They warehoused a lot of materials during that time and created now a permanent warehousing function for people to have access to simple things like, clothing. We worked with multiple food agencies to make sure that people had food post the storm. This time, when we expected a larger surge, we chose not to have people park in our lot, knowing that their vehicles would be at risk, like I said, and transported them there. So you do as much as you can, but there's still hardship out there.
With the recent shortage of IV fluid, I was wondering what aspects of conservation and medical supply conservation play into your role, and how do you do that during a time of a disaster?
So it's interesting that once again, post Hurricane Helene, we saw a single point of failure in IV fluids at a Baxter processing facility, and none of us have really been prepared for that. So we've gone into how do we ration, how do we orally hydrate, how do we use limited hydration fluids. There have been systems canceling surgery. I would say one of the things we learned even back from COVID was on basic supplies. We created our own warehouse for things that we knew were going to be high utilization items and have a rotating stock system there to make sure that we have available supplies for things like a pandemic, for example. You can't stock every supply. I don't know what we're going to learn from this most recent issue with IV fluids, but to have a single point of failure in a country is really not acceptable. And I think we're learning it the hard way once again. So that will cause us to have to think differently. We do have some backup ability because we have a processing center in which we make some of our IV infusion supplies. And I was just talking to our pharmacist the other day about perhaps we need to think about expanding that service or being able to scale it during a disaster.
So, Dr. Nygaard, looking at some of these past hurricanes and events, what strategies have worked best in recovery? Maybe some that other health systems have learned from as well.
I think one of the lessons we learned is you can't be prepared enough. And there is a reason, you do have a process in terms of how you communicate in your organization. In the initial Ian storm, people's best efforts, I would say we did violate some of those issues of the incident command center as people were trying to, kind of have best efforts. Some of it broke down because of the challenges with communication and part of our infrastructure. Following that and keeping order in the house, I think, is very important in terms of responding appropriately to any type of disaster. There are always things that are unexpected or unplanned that you haven't drilled for, you haven't prepared for. So making sure you keep orderly process really does matter. We saw that this last time in Milton, where I could see our whole response was much more organized, much more calm, much more sense of order. And it made a big difference in preparing for the storm. Some of the other things I think, we've talked about just being prepared for major outages like the cellular tower, like water, like having gas available. We did bring in, by the way, gas tankers for our people to have availability for gas if they did have a vehicle that was functioning and were just specifically available for emergency medical staff. I think one thing we tried to also do in our community, we have a lot of special needs people. At the Children's Hospital, we tried to make sure we did house and support those families since they have higher medical needs. We tried to, communicate early about getting people evacuated into shelter, not just us, but even I would say our state has been much more rigorous, making sure people take them seriously. In Ian, I think we had about 150 deaths in Florida because people didn't take it seriously. But now even people who've been here a long time recognize the potential impact. In Milton, we just had a 5-foot surge, whereas Ian was 15 feet of surge. So, a house at ground level would simply be underwater.
Dr. Nygaard, thank you so much, not only for your time today, but also everything that you do for your staff at Lee Health as well as your community. Really appreciate it.
Thank you so much. And I'm blessed that we have such a great staff who care so deeply about our community and is committed to their service, even in light of their own hardship.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.